Hey there, and welcome to your NCLEX Art and Preparation session. Get ready to take your exam preparation to the next level with these practice questions. On your screen, you'll see two main sections, the question on the left and the answer choices on the right. But here's where it gets interesting. I'll read each question out loud, and as I do, you'll see a red highlighter moving along, keeping you focused on exactly what matters. Once I finish reading the question, you'll have some time to think through your answer. Keep an eye on the timer in the top right corner. It's your countdown to make the right choice. When the timer hits 0, we'll break down each option together. I'll show you why the correct answer is spot on, and we'll dive into why the other choices just don't fit. Plus, I'll share some pro strategies to help you tackle questions like a true NCLEX champion. Ready to crush it? Let's dive in. Medical emergencies. Let's see some questions related to this topic. A 25-year-old pregnant woman presents to the emergency department with rapid onset of severe respiratory distress, hypoxia, and pulmonary hypertension. She is in her third trimester of pregnancy and was admitted for delivery. What is the best initial intervention for this patient's condition? The options for the question are also given on the screen as Option A, oxygen supplementation. Option B, intravenous fluids. Option C, intubation. Option D, an emergency caesarean section. You can take some time to go through the questions and options on the screen. The timer runs on the top right side, but if you need more time, you can pause the video as well. The right answer for this question is 8, oxygen supplementation. Oxygen supplementation is the best initial intervention for this patient's condition as it is the most immediate and crucial step in treating amniotic fluid embolism. This will help to alleviate the hypoxia and respiratory distress that the patient is experiencing. That was an easy one. I am sure by the time you complete all the practice questions, you will find more confident in solving questions like this. Let's see another question. Hey, I just wanted to quickly share something with you that I think could make all the difference as you prepare for the NCLEX RN. I know how stressful it can be, especially when you're balancing everything, clinical hours, coursework, life, and trying to carve out time to study. Trust me, I've been there. That's why I highly recommend checking out the 4 weeks to NCLEX RN Questions and Answers practice guide. It's a taken for preparation of this video. What's awesome about this guide is how it's designed specifically for busy students like you. It breaks everything down into manageable weekly goals, so you're not overwhelmed and you know exactly what to focus on each week. The structure is simple but really effective. Week 1 sets you up with foundational strategies and helps you get comfortable with the question formats. Week 2 digs into the core nursing concepts, things like patient safety, prioritization, and critical care. Week 3 covers pharmacology and body systems, which we all know can feel like a huge challenge. Then, Week 4 is all about practice realistic exam simulations and reviews that really help you gauge where you stand. What I love most about this guide is that it doesn't just focus on the right answers. It's all about understanding why the correct answers are right and why the others aren't. It really teaches you to think critically, which is such a huge part of the NCLEX. If you're looking for something to help you stay on track without adding more stress, this guide is worth checking out. I really think it could make your prep a lot smoother and most importantly, help you feel more ready. Good luck. You've got this. A 35-year-old woman presents to the clinic with heavy vaginal bleeding and an irregular menstrual cycle. She reports having had this issue for several months now. What is the best treatment for this patient's condition? The options for the question are also given on the screen as Option A, an oral contraceptive, Option B, a hysterectomy, Option C, estrogen, Option D, a non-steroidal anti-inflammatory drug. You can take your time to go through the questions and options on the screen. The timer runs on the top right side, but if you need more time, you can pause the video as well. The right answer for this question is C, estrogen. The best treatment for this patient's condition will depend on the underlying cause of her abnormal vaginal bleeding. In this case, she has reported heavy bleeding and an irregular menstrual cycle, which is consistent with dysfunctional uterine bleeding. The administration of estrogen is a common treatment for this condition and can help regulate the menstrual cycle and reduce heavy bleeding. That was an easy one. Let's see another question. If you're watching this video and feeling the pressure of tackling those challenging NCLEX RN case studies, you're not alone. But what if I told you that the strategies and tips we're discussing here are all pulled straight from a game-changing resource designed to take your exam prep to the next level? Actually, the strategies for the case studies in this video is taken from NCLEX RN Case Studies Exam Practice Bootcamp. This book is packed with over 100 in-depth case study questions, each carefully crafted to bridge the gap between theory and real-world clinical practice. Whether you're dealing with anxiety or feeling unsure about the complexities of case studies, this book is the perfect way to transform fear into confidence. With a focus on first attempt success, this bootcamp will not only teach you the right answers, but also guide you through why other options don't make the cut, so you can learn from each mistake and grow stronger with every case. The author has helped countless students just like you conquer their NCLEX on the first try, and now you can benefit from their expertise too. So, if you're ready to boost your confidence, master those case studies, and head into your NCLEX exam prepared like never before, the NCLEX RN Case Studies Exam Practice Bootcamp is your trusted companion. You can find it right now. The link of the book is given in the description below. A 25-year-old woman presents to the emergency department with decreased urinary output, intense abdominal pain, shortness of breath, diarrhea, and thirstiness. She reports having undergone in vitro fertilization a few days ago. What is the best treatment for this patient's condition? The options for the question are also given on the screen as Option A, hospitalization. Option B, anticoagulating medications. Option C, increasing fluid intake. Option D, respiratory support. You can take some time to go through the questions and options on the screen. The timer runs on the top right side, but if you need more time, you can pause the video as well. The right answer for this question is A, hospitalization. The best treatment for this patient's condition will depend on the severity of her symptoms. In this case, she is experiencing several symptoms that indicate a life-threatening medical emergency, including decreased urinary output and intense abdominal pain. Hospitalization is the best initial intervention as it will provide her with immediate and appropriate care and monitoring. Let's see another question for more practice. A patient presents with tenderness, swelling, and redness around the mastoid bone, severe ear pain, a temperature, pus and other ear drainage, and a displaced pinna. The patient is diagnosed with mastoiditis. What is the best treatment option for mastoiditis? The options for the question are also given on the screen as Option A, myomectomy, Option B, antibiotics, Option C, mastoidectomy, Option D. A, B, C. You can take some time to go through the questions and options on the screen. The timer runs on the top right side, but if you need more time, you can pause the video as well. The right answer for this question is D, all of the above. Mastoiditis is a serious middle ear infection that adversely affects the mastoid bone. The best treatment option is a combination of intravenous antibiotics, a myomectomy, and mastoidectomy. All three options are important in treating mastoiditis effectively. Let's see another question for more practice. A patient presents with loss of sensory and motor function, pain, nausea, vomiting, impaired urinary function, paralytic ileus, and hypothermia. The patient is diagnosed with a spinal cord injury. What is the best intervention for a spinal cord injury? The options for the question are also given on the screen as Option A, immobilization and stabilization of the spinal cord. Option B, pain management. Option C, correction of hypothermia. Option D. A, B, and C, you can take some time to go through the questions and options on the screen. The timer runs on the top right side, but if you need more time, you can pause the video as well. The right answer for this question is D, all of the above. Spinal cord injuries are a medical emergency and all interventions should be done to preserve life and prevent any further spinal cord damage. Immobilization and stabilization of the spinal cord, pain management, correction of hypothermia, and other interventions such as intubation and mechanical ventilation are all important in treating spinal cord injuries effectively. Let's see another question for more practice. A 50-year-old male presents with redness and discoloration of the skin on his right calf, along with pain, tenderness, swelling, and warm skin at the site. He also reports shortness of breath and chest pain. The patient's vital signs show tachycardia and hypotension. What is the most likely diagnosis for this patient? The options for the question are also given on the screen as Option A, deep vein thrombosis. Option B, cardiogenic shock. Option C, anaphylactic shock. Option D, neurogenic shock. You can take some time to go through the questions and options on the screen. The timer runs on the top right side, but if you need more time, you can pause the video as well. The right answer for this question is B, cardiogenic shock. The patient's symptoms of redness and discoloration of the skin, pain, tenderness, swelling, and warm skin at the site suggest deep vein thrombosis. However, the presence of shortness of breath and chest pain along with tachycardia and hypotension point towards a possible cardiac malfunction, and therefore the diagnosis is likely to be cardiogenic shock. Let's see another question for more practice. What is the most appropriate intervention for this patient? The options for the question are also given on the screen as Option A, application of heat. Option B, administration of anticoagulants. Option C, administration of dopamine. Option D, administration of atropine. You can take some time to go through the questions and options on the screen. The timer runs on the top right side, but if you need more time, you can pause the video as well. The right answer for this question is C, administration of dopamine. The patient is suffering from cardiogenic shock, which is characterized by lack of adequate cardiac functioning and insufficient cardiac output and systemic circulation. To increase the patient's blood pressure and cardiac output, the most appropriate intervention would be the administration of dopamine, a medication that increases the sympathetic nervous system activity. Let's see another question for more practice. What are the potential complications for this patient? The options for the question are also given on the screen as Option A, pulmonary embolus. Option B, respiratory and cardiac arrest. Option C, massive circulatory collapse and death. Option D, cardiac arrest, renal, cerebral, and / or hepatic damage and failure. You can take some time to go through the questions and options on the screen. The timer runs on the top right side, but if you need more time, you can pause the video as well. The right answer for this question is D. Cardiac arrest, renal, cerebral, and / or hepatic damage and failure. As per the case study, the patient is suffering from cardiogenic shock, which can lead to various complications such as cardiac arrest, renal, cerebral, and / or hepatic damage and failure, deadly cardiac arrhythmias, and death. The other options listed are complications of different types of shock and not cardiogenic shock. By the way, the strategies we've been talking about in this video, those approaches for tackling tricky NCLEX questions and managing the different types of questions are actually taken straight from a resource I really recommend. The new NCLEX R in Practice Question Bank. If you're looking for a great way to practice and apply those strategies, this book has over 700 questions that mimic the real exam format, and each one comes with detailed explanations that help you understand exactly why the correct answer is right and why the others aren't. It's a great way to reinforce the strategies we've been covering here today. This book is especially useful if you're struggling with the new next generation NCLEX format or just need a structured way to build up your confidence with daily practice. You'll find it's all about practicing smart, not just hard, and really honing your test-taking skills. So, if these strategies are helping you out, this book could be a solid next step to boost your preparation even further. Just thought I'd share that in case it's something you want to check out. You've got this.